Hi, everyone. I'm Jonathan Mitchell, Vice President, Research and Policy at HealthcareCAN. It's been an absolute pleasure to continue our collaboration with the Mental Health Commission of Canada over the past years, and in particular over the past 3 years, to co-lead the Quality Mental Health Care Network. I'm delighted to contribute with my colleagues to this journal article in Healthcare Management Forum that really highlights the key elements of mental health care in Canada and how that can be improved.
Hi everyone, I'm Emily Falwell, Policy and Research Analyst at HealthcareCAN and a leading contributor to the Quality Mental Health Care Framework article in Healthcare Management Forum. Improving quality mental health care and strengthening the mental health care system will not happen overnight, but we must start somewhere, and the framework is the right step to set out our goals of what we are working towards, which is to provide Canadians with mental health care that meets their needs and the needs of their community.
I'm Siri Chinduri. I'm a policy and research analyst at HealthcareCAN, and I'm one of the co-authors of the journal article in Healthcare Management Forum. Access to mental health care, particularly quality mental health care, is extremely important at this juncture during the COVID-19 pandemic, with everyone reporting, from patients and providers reporting acute mental distress. And we are very happy to have been able to include their perspective in creating this framework, which is a first step towards providing accessible, appropriate, people-centered care to everyone that requires it.
I'm Rebecca Justman. I'm the Director of Policy with the Canadian Centre on Substance Use and Addiction. I can certainly speak to the fact that the COVID-19 pandemic has accentuated the relationship between mental health and substance use, and that access to services is not keeping up with the increasing need. The quality dimensions reflect the need for coordinated approach. The principle of access is so important in the field of substance use, where people in crisis are faced with navigating often complicated admission criteria and choices between waiting lists and private care, with very little assurance that the care that they reach will be evidence-based or effective. We also know that stigma is a significant barrier to seeking services, and one that results in discrimination throughout the healthcare system, as evidenced tragically in the case of Joyce Echaquan, making the dimension of stigma-free and inclusive also vitally important. So thank you for the work that you've done in pulling together this framework, and I look forward to seeing it roll out.
I'm Amy Pack, Senior Program Manager at the amalgamated organization formerly known as CPSI. And as we all know, mental health concerns us all truly, and I think we've all had experiences, personal and throughout our larger networks throughout the last year especially. COVID's really increased the demand of mental health services needs, and our system really isn't adequately prepared to meet our basic needs and keep patients safe in this context. So we're really excited to see the Quality Mental Health Care Framework build upon those framework foundational goals that are really guiding quality and patient safety. COVID brought forward so many challenges, and it's times like these that call out the need for concerted action towards three particular goals. The first one is accessible care, to make mental health services available for all diverse people across Canada. The second one is appropriate care, addressing the current inefficiencies of the mental health care models and infrastructures that were always very prevalent, but are even more noticeable now throughout a time of need during a pandemic. And then finally, but also very importantly, safe care for all. And this includes prioritizing supports for the psychological safety and well-being of healthcare workers. So we really do support these goals and others set forth by the Quality Mental Health Framework. We encourage all actors in the healthcare network and system to align with these framework goals. Thank you.
Hello, everyone. I am Samaria Nancy Cardinal. I am a patient advocate with Patients for Patient Safety Canada. Our current healthcare system is broken. It is not recovery-based, and structural stigma is inherent in everything that is done. So this new mental health framework is needed, and I highly support it. And I think we need to move to a system that is recovery-based, not Band-Aid solution. We are not helping individuals by shuffling them in and out of help only when it is an emergency. We need to change how we think and how we help people. So going to a new system is a wonderful, wonderful thing that we can do to help everybody involved. Let's all work together in this. Thank you.
Hi, I'm Stephen Vale, the Canadian Medical Association. I really like this framework. I like its dual focus on access to care for citizens of Canada, as well as the providers of care who also require services and safe places to work and practice. So I think it's a very comprehensive framework that addresses a lot of the major issues that we see every day.
Hi, my name is Mike Villeneuve and I'm the Chief Executive Officer at the Canadian Nurses Association. I want to thank the members of the Quality Healthcare Network for the great work done, rigorous work, to bring groups together to talk about mental health needs and to generate the new Quality Mental Health Care Framework. The timing of the release of the framework is interesting when we are a year now, just about, into the pandemic, which has caused so much suffering. Certainly we are aware of it among nurses, physicians, and other healthcare providers, and I think don't yet really understand how traumatized some of them are going to be coming out of this, and in other cases maybe less traumatized and simply so exhausted that they've really used up any sense of emotional wellness that they had left to give. But the bigger issue is across society, and in my view we just haven't even begun to unpack the amount of loss and the cost personally to people of some of what they've seen and lived through, and all of it under a veil of fear from this big scary thing that in the end could kill you. So it's new to most of us, and it's been a very, very tough year, and I think we have ahead of us a great deal of healing to do across the world, but certainly across our society and across our health workforces. With regard to our stamina, resilience, and ability to start again after so many really very important losses for people, even if it's just the loss of what's a normal routine, loss of your job, loss of loved ones. So the framework for me comes at a really opportune time as a reminder of the sorts of elements that need to be in programs to help us move forward after this. And certainly in our lobbying work at the Canadian Nurses Association, we've been particularly concerned about accessibility, not just whether there is a service, but once there is, can you afford it? Because care can be quite expensive in the area of mental wellness. So the framework will be useful to us in our lobbying work, and I think will be useful in a larger sense for all of us across Canada as we think about what kinds of programs and services we're going to need, first to recover from this pandemic's side effects on our souls, but then what we do with mental health services in the future going forward. So again, I want to thank the members of the team who did the heavy lifting of consulting and researching and so on, and put together this very useful framework.